Um, okay, good morning, everyone, and thanks for joining us on World Toilet Day. Um, we are really honored to be able to have Marion Wagner with us this morning, and she's going to give us a presentation on transforming school pit toilets into safe facilities. Marion is the director of Breadline Africa. She's had a long and distinguished career. She spent 20 years with Shell International, but she's recently turned her attention more to the NGO space. And she's passionate about her civic responsibility and has done a range of sort of projects, volunteers. She's also been a firefighter and loves being outdoors, has done 50 marathons, 11 ultra marathons. So I think she's a pretty formidable lady. And just to let you guys know that the register for the talk will be available from 10 o'clock. So don't panic. We will release it, and I'll hand across to Marion.
Hi, thank you. Thank you for the introduction. So Marion, I've been with Breadline Africa now for 10 years, and a very exciting nonprofit organization based in Cape Town. We have done infrastructure for many years. If you don't mind going to the next slide. So since 1993, when Breadline Africa was formed, we really focused on infrastructure for educational outcomes. So infrastructure that can improve, particularly the foundation phase of young children in South Africa. So we've become pretty good at putting down infrastructure, particularly at ECD centers, and then at schools where we're just doing libraries and feeding kitchens. And then we decided last year, when yet another child died in a pit toilet, that we really should start tackling pit toilets at primary schools, because that's really where the most vulnerable children are, particularly the grade R's. And that's when we started the pit toilet campaign. And yesterday we launched the 25th primary school together with the Minister of the Department of Basic Education, Sibuyiwe Kwaruba, and also with Dean McPherson, Minister of Infrastructure and Public Works. So it was an exciting milestone for us. And then what I'll do is just take you through on the next slide some of the statistics. And I know there was a question that came through, and I'll talk about what stats I'm using. And you'll hear today on World Toilet Day is the minister talking about eradicating all pit toilets by March next year. And now, how do you count them? It's a very difficult thing, because she's the first one to admit the stats that are out there are not exactly 100% accurate. We know that there are no pit toilet schools in Western Cape and Gauteng. We know that the problem lies particularly Limpopo, Eastern Cape, and KZN. Last year, according to the government stats, the Education Facility Management System stats, they were reporting that there were nearly 4,000 schools. Those stats were released now in October, and all of a sudden the numbers have literally halved. But yesterday, when we were at the launch, the circuit manager for that particular area said 80% of her schools still have pit toilets, and that's just an hour from the airport. In Hillcrest in Durban, we know of a number of schools just 3 kilometers from the most expensive private school in South Africa. There are still pit toilets. So I think it's just the definitions and how they counted. Go to the next slide. So what I've done here is I've compared the education facilities management system that the government releases. The top one is 2023, and the bottom one is the data released in 2024. And if you include EnviroLoo, so EnviroLoo is a solution to sanitation at schools where there is limited water supply that tend to be dry toilets with a ventilated improved pit, which is the number next to it. You're going to see that this number starts to increase massively. Even if we take the revised numbers, you're there now. If you're looking at PIT, EnviroLoo, and VIP, you're looking at over 10,000 schools of the 22,000 schools. So VIP is definitely a ventilated improved pit, is definitely an improved solution. Anything over the bucket system is an improved solution. But many of the ventilated improved pits still function with a pit underneath it. And depending on the soil type and the way it's been structured and the depth of the pit, it can still be a tremendous hazard to children. If the fly traps and the vents are not managed on these toilets, the smell is unbearable. And if the pedestal that is used is also broken, the risk of a child then falling into a pit that is more than a meter deep becomes a health risk to the child. So as you can see, I don't know how the minister, with all respect, and I'm working in partnership with her, I do not know how we can clear all schools of pit toilets by March next year. But we will do our best to keep going for however long it takes to see how many toilets we can eradicate. So we're focusing right now on schools where there are pit toilets for children. What also happens is when the government counts the stats, if the school has a flushing toilet for the principal or for the staff, which is often the case, or a poor flush toilet, that school sometimes does not get classified as a pit toilet. So the one we launched yesterday in KZN, which you may have seen on SABC News last night, that school had something like 12 toilets flushing. Most of them didn't work and they were for staff only. 700 children used 6 pit toilets. And the little ECD center that was there, 70 children used one single pit toilet that was on the point of collapsing, that was already full. And the other point to mention as well is when they put in VIPs or EnviroLoos, the dry systems, they don't close up the old pits. So if you don't close up the old pits, that becomes a hazard for, that's mainly where children have died, in the disused pits. And of equal concern and danger is the infrastructure surrounding the pit toilets. With a sledgehammer, you can take down that whole infrastructure. They were built 100 years ago. There are no foundations, and more children are injured from the infrastructure than they are from actually falling inside the pit. So I'll just run you through the presentation now. And if you've got any questions, I don't mind taking them in between or taking them at the end. There are a few slides, but the slides are going to go quite quickly because I'm just going to show you a lot of pictures. So on the next slide. And again, this is just the count from the government on saying the number of pits. So Breadline Africa, where we are right now is, sorry, but yeah, if we just have a look at that one, they're saying that, pits only is that. And I think that's where they're saying that even the principal doesn't have a proper flushing toilet. So the problem is huge. And then on the next slide, what Breadline Africa set itself a target last year to try and raise 156 million, and that would only cover 240 of those 4, 5, 6, 8,000 schools. But if we could raise that, then we could be completing 4,000 toilets. And what we'll do is we'll just keep going as long as we can still raise money from industry and from private individuals and foundations. So as I say, we've reached 25 schools already. That's already impacted 12,000 children. If we go to the next slide. The rationale, and these are pictures, all the pictures that I'm showing you are pictures that we have physically taken. This one on the left is a school that we addressed, where you can actually see the toilet has already gone through the basic structure that was put in place. And children have such a fear of using these toilets that they often don't use them. They will go behind the block or into the open field. So we believe that it's way more than 1 million children. And besides the health risk, because wherever we find schools with pit toilets, we also find no hand washing facilities. So if there is a standpipe that is available, all those children come out of the pit toilets and use that standpipe to drink water, not to wash their hands. There is no soap. At all of the schools that we've been to, we've probably done more than 60 evaluation of schools, there is no soap. There is no hand washing facility. So you have the health risk and children being absent from school, not just children, but teachers being absent from school, and there is no dignity. The toilets that you see, the doors are often missing. The children have absolutely no privacy when they go to the toilet. That's why they'd rather go in the long grass or behind a building. And there is also no privacy for girls. So girls tend to miss a week of school a month when they've got their periods because there is no way for them to change. So the impact of the pit toilets in South Africa is huge on children attending school, their dignity, and children learning, concentrating, and staying in school. So on the next slide. So the solution that we've done to date is we've closed nearly over 400 now school pit toilets and put in low flush systems. We've also put in dry systems. If there's no water, you obviously can't put a low flush system in unless it's a poor flush, which we can do. But if there's no water, then we respect that it has to be a dry solution. And in the last 12 months, we've now impacted over 12,000 learners that now have access to flushing toilets. The one difference that Breadline Africa has over many of the other suppliers are out there is that we'll leave no unsafe pit behind. It means that if we work at a school and we replace it, we close every single pit. That is the hazard. When we close it, we either fill it in with rubble that's come down from unsafe structures or desludge it. And then there's a concrete slab that goes over the top. So there is no way that that is going to collapse in on itself. So that's one of the really important aspects of the work that we do. And then if we continue, the return on investment of investing in a school mentioned now, I mean, it's not just the issue about children being sick, it's absenteeism, it's health cost for treatment, it's parents having to take children to doctors, the spread of disease is incredibly high, but it's children not staying within school because of absenteeism means they've missed so much schooling, and then the children that don't graduate. So what we use this for business terms to say that the return on investment of every rand that is invested in finding a solution for the pit toilets gives a return of more than R2.19. I think it's actually probably 3 or 4 times this, but it was a study we did last year at a university, and we really made it push the numbers down rather than sort of overemphasizing it, but we believe it is much higher. So on the next slide. The low flush system, which is our preferred system that we put in, because the schools that we work at, there is no waterborne sewage. So you cannot put in a sewage-based system. It isn't going to work. So what we do is septic tanks. All the components of everything that we use is made in South Africa. We don't import anything. And all the work that we do makes sure that we employ local labor in that community as well. So a low flush system works with all the components on the inside for the handle only, and then all the external components are mounted on the outside and screened off. And I'll show you some of those examples as well. The tank size we generally use is 6,000, but if there are less than 100 children, we tend to not work at that school because that school is at risk of closure. But if it's around 110 children, we may use a lower size septic tank. The way the septic tanks work is there are 3 chambers in each septic tank that allows the fecal matter, the solids, to drop to the bottom of the septic tank. The water is pushed up at the top, goes into the next chamber. As it fills up, it goes into the final chamber, which is just the water, which then goes to a modular soakaway, what they call an evapotranspiration system. So that means that if there's less water in your main tank, the fecal matter will decompose aerobically and anaerobically a lot quicker. You do need water, you can't just have a dry system, but the more of the excess water that is pushed out into the soakaway system allows your septic tank to last a lot longer. So we try and keep the intervals between 3 to 5 years so that the school doesn't have the cost of emptying that. And for the first 5 years, we'll manage that for the school as well. So the soakaway system means that the groundwater is not contaminated because it's gone through that sort of process, that cleansing process, and then through that. And I'll show you some examples as well. On the next slide. The dry system, so where there is no water, and particularly in the areas like the Eastern Cape, even grey water is difficult to come by, and you can't then just even pour water down there at all. We have to go for a completely dry solution. There is nothing else that you can do but to then put the ventilated pipes in and to build a chamber. The difference is our chambers are never more than 1 meter by 1 meter. Accessible chambers that can then be desludged, and they're smaller chambers. They can be desludged manually with a portable little honeysucker machine. And the reason for that is a child that falls into a 1 meter chamber won't drown. They can stand. The precast structures that we use are cement, but we're now looking at more environmentally friendly type of structures as well that are going to hold up to time. And then the all the water from the toilet or the urinal, again, goes into a soakaway system. And then you've got fly vents and the vents that you see at the side, which allows the odors to be pulled up to the top with a fly screen to prevent flies going into the chamber. The toilets that are used are urine diversion. There's an example on the right. And that urine diversion system means that it is mainly solid matter that goes into the concrete chamber, allowing it to last or be able to fill over a longer period of time. But I'll go through some more pictures to show what this looks like. Next one, please. That is the way our finished solution looks. If there is this is in Mount Aleph in the Eastern Cape, if there is an existing structure that the pit toilets were housed in, and that structure is still okay, we'll reuse that structure and we'll refurbish it. Very often there are not enough toilets for the number of children. So we go with the government norms and standards, whether you at least have 20 children per seat. So we've just seen at the school we just did now, there were nearly 700 children on 6 seats. That's completely unacceptable. So what we just to put in waterless urinals at schools like this. And then we've got the systems, the tan units at the back there are mounted onto the concrete walls. Each one is an individual unit. And then we also have a screen wall that always goes around. And then we lock all the components and the plumbing at the back because they tend to make very good jungle gyms and the plumbing won't last long. And then what you see on the left is the water tank, but I'll talk about that one for your next slide. So these are the systems that we use that are made in Durban. So these systems can be manually filled at the back or connected to a water standpipe. Every one of these only uses 60 liters of water, can hold 60 liters of water, can take grey water as well. They can be topped up manually, as I say, or from a main system or from a gravity-fed JoJo tank. Rainwater harvesting, if it's feasible, we'll also put in rainwater harvesting connected then to a JoJo tank that feeds these. So each flush is only 2 liters, bearing in mind that a normal toilet can be 9 to 12. The toilets are also, as you see here, there is a little step on the right-hand side. So for the younger children, there's always a concrete step that they can get up to. And then they've got these plastic molded toilets with the seats on the top that have a weight-bearing capacity of 400 kilograms. So we're quite confident we're not going to have a problem with heavier children. The seats are, so there are 3 seats. There's the lower seat, and then there's the child seat that clips into place. So that has an opening of 20 centimeters. Anything more than 20 centimeters on an opening of a toilet seat for a young grade R child is a risk of a child falling in. It does sound incredibly small, but we make sure that that is very small hole. And then on top of that, you've got the top lid that folds down. So a young child won't actually be able to lift the safety lid up because it clicks into place, but an adult can. The doors that we use are also made in South Africa. They're polymer doors. They are very robust. They let in the light because most of the schools don't have electricity anywhere near the toilet. So these let in the light, but you can't see through them. And then they've got a patented locking system where you can padlock the outside of that door, but the child can still get out. So it's got an override. As you pull it, it's not impacted by the padlock on the outside. So no child can be locked inside. Next slide. And then I spoke about the urine diversion. So we can go to the next one. That's just an example. And then, of course, in every school, we also put in accessibility grab rail facilities. One of the things that breaks very often at schools is the flush handle. We make sure we don't use flush handles. We have a nylon-coated steel pull handle. So it's a pull chain. So the child just has to pull that chain. That delivers 2 liters of water. It also avoids any vandalism or breaking of systems. It's very durable. And on the next slide. I see my text has disappeared to the left here. These are the water tanks. They've got a patented design that was invented during COVID so that if the child uses the back of the hand to push the tap up, it dispenses water. As soon as they release their hand, the water stops. So you can wash with 200 mils of water is sufficient for hand washing. Then we've got, if you see those yellow things connected to the gravity-fed JoJo tank, they are soap dispensers that will hold up to 4 bars of hard soap, and they use a grating mechanism underneath. So the child pulls the lever back, the it delivers 4 or 5 grains of soap in their hand, which is more than sufficient to wash with. It actually foams up very quickly. That water that comes from here goes into the soakaway system as well. So from the basin into the soakaway system. Next slide. And then just in terms of, just to give an idea of what it costs, there's always this perception, why would it cost anything between 35 to 40,000 per seat per child? But that's because all of these elements combine together to take that cost up to what it is. Because people say, well, a toilet at Builders Warehouse only cost me 5,000 Rand. How can you get this cost to 35,000 Rand per seat? But in many of the areas, we have to do tree felling, soil testing. We've got to put the concrete foundations down. We've got to take down the other structures. So there's a lot of concrete work that goes on site. The JoJo tanks, the piping, the connections, all of that adds up to approximately an average of 35,000 per seat. So I just wanted to give you an overview, and then it includes a 5-year maintenance contract as well on that school, where they do regular inspections. If there's any problem blockages in the pipes, any breakages, they fix it, and then any desludging that's required. So I just want to, on that particular slide there, that structure in the background, that same slide, it's fine. That structure in the background is with the grey roof, was there when we arrived at the school in Umsunduze in KZN. And that was a government-built structure as a solution for their pit toilets. The supplier put in fantastic toilets. They looked amazing on the inside. However, they didn't put in a septic tank. So within a week, you can imagine the toilet started overflowing because it didn't go anywhere. So at that stage, we didn't do anything with those government toilets. We hadn't started our partnership with the government at that stage. So we felt that we couldn't actually work on a toilet solution that was incomplete. So we built them extra toilets. But at any time, the school can go and add another septic tank and make those other toilets function as well. Right, next slide. So that we started with the first project in May last year at Umsunduze Primary School, taking down all the old structures. And at that particular school, we ended up putting in 18 toilets. And there were 450 learners. So that's just to meet the ratio. In the next slide. Now we're going to go through these slides now quite quickly. These are all examples of schools before and after and what they look like. If the structure outside was sound, so we could work inside the structure, close those pits, get rid of all the old toilets, repaint it, redo the doors, etc. And here you can see an example of the 6,000 litre septic tank system that is used, and then the amount of digging and groundwork that goes place in order to put in the modular soakaway system as well. On all of these, whenever we go to a school, 70 to 80% of the work is done using local labour. We connect with the business forums, the school governing body, and they select the labour from the local community that will come and work on this project for work experience, but also to get the community involved and buy into the project as well. And then on the next slide. And then we're just going to now just keep rolling through the slides. These are our schools again. We can just keep tapping through the slides. Another school again in KZN. Before and after solution, and we'll just keep going through, Nikki, if you don't mind. So what we take so for granted with the simple aspect of flushing toilets is for so many of these children so life-changing. We've experienced the smiles of the children who for the first time actually see the toilet flushing, the amazement that they can actually look down and just see white toilet bowl and not see contents, and the fear of snakes and spiders and flies and everything else. And I think the biggest thing is the overwhelming stench. I cannot describe the smell And in some of these schools, the smell of the pit toilets disrupts the classrooms. So again, that was a before and after you just saw there. And they can't teach the children because in summer it is so overwhelming. Yeah, this was a school that was just incredible. And while they were still constructing, the children were still using the old pit pedestals. And well, one of the things we also do, unless the school really objects, is we always put them into bright colors. It allows the children to differentiate between the boys' toilets, the girls' toilets, but it just makes it more fun. Um, this was a retrofit that we did in Limpopo. Those are the Enviroloos on the black structures that you see. They're often the plastic breaks in the sun and they often collapse. So this school, again, all the toilets were blocked, nothing was working. And what we'll do here is go in and put in the plastic long-lasting toilets. Here was a modular soakaway system being put in to connect all of this. The waterless toilets, the rain harvesting system, and again, the JoJo tanks were put into the school. And then we just can keep scrolling through. There's an example of the modular soakaway system there on the left. And those toilets you saw just now ended up looking like this by the time we'd finished. So anything that lies around like this becomes a hazard. Everything gets cleared away from the school. This was a completely dry solution in the Eastern Cape. So this was what it looked like. Demolished everything. Nothing could be saved here. On the bottom right, the modular soakaway system going in here. And then these are the sort of the 1 meter chambers that are lined chambers. So there is no leaching into groundwater. And this was just the work in progress as they were doing it with the vents as well to take away the smell. So with a ventilated toilet, you are always going to get a slight smell, but nothing compared to the smell of an open pit. This was another school in KZN. All of these structures we actually were unsafe and we destroyed all of this. Flattened it, removed everything. This was their solution at the end. Then this is the one we launched yesterday with the Minister of Basic Education, and that is what 70 children were sitting on that. If you look at the bottom of the middle one there in the bottom screen now, you'll see the rust on those toilets, which means underneath that is a gaping hole, and that was already full. So for 70 children using that was a real safety hazard. This was left on site when previously where toilets had collapsed. So we removed all of this, launched this one yesterday. And again, we refurbished the existing toilets on site. We'll just keep going through. Okay, so I've just mentioned on this particular one here, what we've looked at is on the government safe project and what hasn't worked at many of the schools and what we can do differently is work with approved suppliers. We have a preferred supplier, they have a standard that we follow. They're able to scale up very quickly. And it takes us literally 2 weeks from when we start at a school to when we finish. On some of the government projects can take up to 6 months and cost millions. Our solutions are as low as we can get them in terms of cost. And we also do monitoring, in-depth monitoring and impact reporting for funders that require that level. Again, government standards have to be adhered to. We engage with traditional leaders and local education departments, and we have a multiple solution, as I've spoken about, the low flush, the dry, and the retrofit. Okay, then on the impact. So this was a report that we've done for the Development Bank of South Africa. They funded the removal of pit toilets at 8 schools. So the impact team would go in, would have a look at data at those schools. So there were 2 schools in each province of the affected areas, and number of children and educators are recorded, and then they go through looking at a baseline before we start and identify what are the key issues that are faced at those schools from, satisfaction level, safety, illness, And then also asking the principals if we can have any of the attendance registers so we can understand how many children are ill. Obviously, they don't keep records of what the illness is that the child has, but very often it is related to diarrhea, and that spreads very quickly through the school. And then the report that then we provide is, at baseline, we'll go back in 6 months, do a midline, in 3 years, do an end line. And then we monitor all the different aspects of the findings that we saw, what the needs were. We put in the recommendations, and then we go back and see what is the difference, and work with focus groups with the girls, with the teachers and the SGB to understand, is this actually having an impact on the educational outcomes of the children at the school? That's a couple more slides, and then I'll take some questions. So go on the next slide. This is a list of schools that we now have ready to go. They're all waiting. The ones that I've highlighted in there is an interesting one, because in red, these are 2 schools that are absolutely desperate, but we're not getting government support because they say the numbers are below 100. A school below 100 enrollment means that it's at risk of closure. If it closes, those children have to use another school. If it's more than 5 kilometers for the children to walk, they need a bus. If there's no bus available, the school still tends to stay open, and then all the infrastructure of that school deteriorates. So the second one in red there with 82 children, they've already had a child that they pulled out of the pit, horribly scarred. They managed to get him out, but he got badly cut on the way back up again. So and so traumatized. The children, they burn fires outside the entrance of their pit toilets because of the snakes that are in there. Next slide. So this is one in Mount Aleph that we're looking at the moment. As you see, the children don't even make it to the toilet. They are so terrified that they'll just go absolutely anywhere. And again, these structures are in such a bad condition, a little bit of wind, and that all that zinc will fall on that child. Next slide. And then this is also classified as functional toilets. No privacy. So it may be a little bit safer if that concrete doesn't collapse, but I mean, this is right next to a road that children have to squat. And the next slide. And then don't worry about that one. We can go. That was a video, so we can just continue. This is just what the government says they're going to invest. So unless there's any questions, I'm not going to worry with this slide, because we know that the investment here is government can't commit to because of insufficient funding on the budgets. And you can see these numbers. I mean, this was in February alone, where the government needs to invest. I mean, there are schools with no toilets, and 235 million rand that is going to be required. They're going to do an annual investment there of 33 million. Upgrading a sanitation. I mean, these numbers are absolutely mind-blowing, and that is one of the reasons why the government just cannot get on top of this backlog, because these funds often then just don't get used by municipal departments because they don't have the skills and expertise or suppliers able to do the infrastructure, but very often the budgets get reallocated. Okay, the next slide. Okay, that's it. Right. So I'm happy to take any questions.
Okay. All righty. So I see the link has been uploaded. So anyone wants to just click on the link. Are there any questions from the floor? I'll open the floor for any questions. Okay. Koketsu, can you monitor? I can't see any. Oh, there we go. I can't see any questions.
Can I just jump in? Just not sure how to raise a hand.
Sure, Temba, off you go.
Thank you so much, and thank you to the presenter for the excellent presentation and the work that's done on the floor or on the ground, rather. I just have one quick question. How do you then, you or perhaps or government, deal with the security issue? I'll probably say precisely the vandalizing, because I know it's one of the big, issues that is faced in these rural areas. How is it that managed? Thank you so much.
So it's a very good question. It's very difficult to manage. What we see is a huge difference in the principals of the schools. So a principal, when we go and do a site assessment at a school, and the school is absolutely covered in litter and graffiti, we won't even start the project because we can't risk, we don't get any government funding. So other than Development Bank of South Africa, we've had no government funding. So we work with companies like Investec, Sibanye Stillwater, Discovery, any of the banks that were willing to fund. Glencore is funded twice now. So what we do is, in order to protect the brand of the investor, is make sure that the principal is 100% committed. You don't always get it right and principals change. But as soon as we see a school grounds covered in litter, and doors that are broken, you are going to find roofs are missing. You are going to find there are things that are vandalized, and of course, every child is going to graffiti. But also, there's a clear link between if the conditions of the toilets that they've got are so bad, they are going to not respect them. When you give them brand new toilets, life changing, it restores dignity. We're finding that we've had nothing vandalized. So we may have had a toilet roll holder that may have gone, but nothing has, no doors are being kicked, no seats have been broken off. It's strange phenomenon that when you have something that actually impacts your dignity, you don't tend to destroy it. But if your school is so run down and your principal actually doesn't even care what it looks like, and you have so little, there is a lot of anger. And we find, particularly in secondary schools, the vandalism in secondary schools is high. Primary schools tends to be a lot less, but it all comes down to the principal, the way he manages that school and the staff. But yeah, you're never gonna impact that. And again, a toilet, even the best flushing toilet that you have, if it's not kept clean, then it's going to look exactly like a pit toilet. It's going to have the same health implications in a matter of time. And that is why we go and do monthly inspections and a lot of training. And I see there's a question there as well. A lot of training about how to keep the toilets clean. And we often give them mop buckets and septic tank safe cleaning materials. So we're looking for sponsorship at the moment from companies that can provide these cleaning materials to schools because they tend not to use the budget that they allocated, which is quite limited for cleaning materials. But a basic toilet brush, and the toilets are also designed in such a way that they are easy to clean and nothing sticks to it like it does with some of the toilets where, everything will stick and then you need the toilet brush. These toilets tend to be designed in such a way that it sort of drops down quickly without hanging on the sides. It's quite a gruesome subject, particularly just after breakfast.
Okay.
I see a question there. Shall I answer the question about the homes surrounding the schools and the
yes.
sanitation? So yeah, what we see very often, and we're incredibly rural areas. So a lot of the children at home, there will be a pit toilet system near their homes. So because you can't have a pit toilet inside your house, what happens with a lot of those children is they at homes they use a bucket system. So inside the house, to save the child having to go out at night, they'll have a bucket or like a chemical type of toilet that you can buy now. There's sort of the camping toilets where you can remove the bottom and then they go and take that to the local pit toilet and swill it out and empty it. There they can use domestos and bleach. In a pit toilet, it's not going to have an impact. But the other thing that we do is if we have a primary school that is a feeder to a big secondary school, and the secondary school looks in really good condition in terms of how it's maintained, that child has to go from primary to secondary. Then it goes from using flush toilets straight back into the pit toilet situation. What we try to do is prioritize that secondary feeder school so that the child then doesn't have to go back to pit toilets.
I see another question. Yeah. Do you want to tackle it? Okay.
Yeah.
What will happen after the 5-year maintenance
That's a good question. So what they do is so every school does actually get a budget for desludging. So there is government funding for desludging, and it doesn't apparently not at high cost. So if at the end of the 5 years they need to empty those septic tanks out, then the school should have the budget or the SGB raise the money for it. So during that 5 years, they get handheld as to, the Coke cans don't go down well into septic tanks, and that, about cleaning. So because they know that the team, whenever they're passing ad hoc, our suppliers will ad hoc come in and do an inspection report. There's always that fear of, okay, we've got to keep these toilets clean because you don't know when they come. If they find they're not clean, a report is written to the principal, a report is written to us, and I'll follow up with the principal and sort of say, guys, please, you've got to keep these toilets clean. But after the 5 years, the school takes over. So, we're only in year one, so we'll have to see how that works. But if it means working with local partners, what we don't do is we don't fund any of the cleaning staff at the school. I know that there are some other charities that have done that, but it's quite problematic because when they move, whose responsibility is to find somebody else? Do they know that the money they're paying to the principal actually does go to the cleaner? And so we tend to try and stay away from that side of it and make it the school's responsibility. Actually, in some of the schools, the older children had a roster, and they go and different classes have a roster for a week, and it's their responsibility to keep them clean.
That sounds well. I mean, in Japan, I think the kids, the youngsters, clean their classrooms and make sure that everything's okay. So I think it's maybe something we should normalize in South Africa as well. Yeah. Okay. Any other questions from the floor? No, I don't see anything. Otherwise, just to say, Marion, thank you so much. I know you said you're a bit ill today, so but thank you for giving your time and of yourself and telling the greater NHLS and NICD community about the wonderful work that you're doing. I think your work will help us do our work better, and hopefully, sort of for us, I work with enteric diseases, so hopefully decrease the amount of diarrhea that we see, but also help sort of youngsters get a decent education, have a bit of dignity and a bit of pride, and help them kind of climb out the poverty
Fantastic,
cycle.
thank you. And I'm happy to, if anybody wants to email, has any questions or suggestions, happy to look at them. Thank you.
Okay. Thanks, guys. Don't forget to fill in the link. It's been posted to get your CPD points. Okay. Thanks, Marion.
Super. Thank you. Thank you very much. Bye, everyone.